read about blood clots, it's not as simple as that. It's a little more complicated, which we'll go into in detail. But when you see the words blood clot in any athlete of yours that you follow, I want you to think a step deeper. So let's find out why and where blood clots occur. Virchow, Virchow, was a very, very famous pathologist. Sometimes he's called the father of modern pathology. And he came up with his famous triad to list the three factors that, when abnormal, can cause abnormal blood clotting. The first one is slow blood flow. The blood needs to keep moving or it slows down and increases the risk for clots. The second, hypercoagulability, means that the blood clots too easily. This can be due to a number of processes. Some people are missing a vital protein or have too much of a protein in their blood, and they're at increased risk of blood clot, for example. And the third factor in Virchow's triad is blood vessel injury. The lining of the blood vessels, called the endothelium, secretes chemicals to guard against blood clot formation. Okay, so here are some examples. Slow blood flow. People on long airplane flights overseas, if they don't move enough, are at increased risk for developing blood clots in their legs. Hypercoagulability. People with cancer are another example of people who can clot their blood too easily. And then blood vessel injury. Some people get a venous catheter put in to administer medicine. That can injure the blood vessel wall and increase the risk for blood clot forming around the catheter. Now, where do blood clots occur? Common places include the legs, the lungs, and the shoulder or upper extremity. Rarely, blood clots will form in the internal blood vessels that feed the bowel or in the brain, but those are relatively unusual. Most blood clots, by far, occur in the legs.